All right. So do I have permission to use this video for educational purposes?
Yes.
Okay. So first, I want you to tell me about your symptoms prior to getting trigger point injections and acupuncture.
My symptoms prior to acupuncture and injections, I was living with like probably 7 to 8, like on the pain scale, 7 to 8. Right now I'm at like a 5 or a 6, and the only reason it's been heightened is because of the weather. Otherwise, I was doing really well at like a 4. My symptoms included my leg would just like lock up out of pain. I couldn't walk. I couldn't do dishes, vacuuming, so really like life-altering symptoms since puberty, pretty much.
Since puberty. So,
yeah.
So that's how long have you been experiencing these symptoms?
I've been experiencing these symptoms since puberty. Through psychotherapy and physical therapy, there's a lot of trauma involved that's stored within my body. And then I'm not sure if it's genetic because I don't know too much about my father, but it's been affecting my whole life so far.
Absolutely. Thank you for sharing that. I want you to talk a little bit about the trigger point injections. So what does a trigger point injection appointment look like as a patient?
A trigger point injection appointment looks like as a patient, you come in, they take your vitals every time. But if you're uncomfortable with certain things, they will totally not make you do anything you don't want to do. For me, I don't like being weighed, so they've never pushed that for me, and that was really important to me when coming in and deciding that this was a place I wanted to be. And so then you get into a gown, again, to your comfortability, whether it be just the top or the bottoms or both. I usually only get the top. And then they walk you through, you can either get like some numbing, like cold stuff on your body if that's okay with you. They also check like what your pain is before and after, if you have certain motions. So like for me, vacuuming and sweeping really increase my pain. So we do certain motions beforehand and after. And then, yeah, it's really quick, 15 minutes to a half hour, just depending on the day. But you're in and out really quick, and yeah.
That's an awesome answer. Thank you so much. And then I'm going to ask again, kind of from a patient's perspective, how does acupuncture work? Kind of how long does it take? What is your experience with that? You're good. Take your time.
So as a patient, my experience with acupuncture, and how long it lasts and all that good stuff. So I've done it twice. My first experience was pretty painful because I did trigger point and acupuncture the same day. Come to find out my body does not like that. So we did our trigger point injections, and then so I'm starting acupuncture again today, and it takes about 45 to 30 minutes because you have to lay down for 30 minutes. They try to make it as comfortable as possible. For me, I bring like my own pillow, and that makes me really comfortable. I have my headphones. They'll put music, turn off the lights, whatever you need to feel comfortable laying in that position. That's
perfect. Thank you. 2 more things. So describe some of the symptom relief or some benefits that you got from the trigger points or acupuncture.
Some benefits relief I got from acupuncture and trigger points. When I got my trigger points, I could do all my chores at home. I can bend. It's like I do this like kind of scooping motion, like kind of like what you do when you shovel snow. And I can like go way deeper, like in the bend. And just being able to my body's not yelling at me whenever I move. And also just sitting here when I first came here, before the acupuncture and everything, just sitting here would give me pain. I don't have that anymore.
Perfect. And last question is, what is some advice you would give to someone who's considering getting trigger point injections or acupuncture? Maybe they're a little nervous or they have some questions. Yeah, just some advice maybe that you would give yourself prior to starting the acupuncture or trigger points.
Some advice I would give to someone looking into trigger point and acupuncture is definitely finding a doctor that you trust. Doctor, coach, really built that trust right away. Very knowledgeable, very much. Something I looked for in a doctor was that they weren't just going to blame it on my weight, and that was not even brought up until like the very last moment, where it was like, if you want to, that's an option, but we're going to focus on your pain. So that was really important to me. And then also just asking as many questions as you have, and there's no dumb question. And also advocating. So like, you have to be like, you have to have, like, that's where the trust comes in with the doctor, is that also just being like, hey, that was not comfortable for me, or can we switch, or can I not do it as often, or whatever you need, which I have found here.
Okay, that is awesome.